Hi everybody, Dr. Suneel Dhand, internal medicine physician. Let's look into the COVID crystal ball over the next several months. Now recently we've had a relaxation of many restrictions across the United States, and that is good news. We've had falling numbers of cases, and this is likely a result of a combination of many factors, including people behaving differently, the vaccination program, and also the fact that many people will have a degree of natural immunity after recovering from COVID infection. All of these things combined have led to a reduction in cases. Hopefully things stay that way. However, we have to plan for all eventualities. Over the years, I have been fortunate enough to meet many people who have a military background. This happened both in the United Kingdom with the British military and in the United States with the American Armed Forces. I've had many colleagues who have worked in the military. I have befriended many people and also met many patients. And one thing that I've noticed about these people, especially in the higher ranks, is that they are trained to think very strategically about issues. And that makes sense, because if you think about it from a military perspective, if you say are planning an offensive, you don't just assume that things are going to work. You have a plan B in case your enemy regroups and then advances at you. What do? You should always be thinking in these terms. And this can help in many different facets of life, not just in military, although in some ways this can be compared to a war. We're just fighting an invisible enemy. So let's look into a crystal ball then. Warning, if you are the type of person who doesn't like to think of worst case scenarios, you may not want to watch ahead as we go over a few potential scenarios of how COVID may pan out. Number one, best case scenario. Before we know it, life as we once knew it pre-pandemic is back to normal. We are gathering again in large groups. We're going to sports events, we're going to concerts, we're gathering together with family and friends, weddings, other events, work conferences are back on. We're zipping around the country. By the fall, I'm on the plane to somewhere like Brazil to go party, and I don't need to make these videos anymore about COVID because the cases that do develop are very mild and we see almost no hospitalizations. Wouldn't that be fantastic? And by Thanksgiving and Christmas, COVID is a distant memory. We're gathering together with family and friends. We're very happy and enjoying a drink or two. That's the best case scenario. Scenario two, let me paint a different scenario for you. And I'm even wearing a dark colored shirt because it's going to be more bleak. We all want everything to work out over the next few months. We want cases to stay low and the vaccine to be 100% effective. But as doctors and scientists, we don't think with emotion, we think logically. Let me paint a scenario for you. Even hypothetically, if 100% of people were vaccinated, that wouldn't mean that the virus would magically disappear. It would still be circulating. And viruses, like all living things, want to survive. And a genetic adaptation that takes humans thousands of years happens much faster in a rapidly replicating virus. And that's why you're seeing stories about new variants and mutations. That's what viruses do. And when people start moving again, there may well be more breakthrough cases, especially in the elderly and vulnerable who may not have responded as well to the vaccine. So come November time, December time, we may well start seeing surges of cases again. And if we look at the healthcare systems of countries like the United States, United Kingdom, and you can go back and Google previous winters and the stories that have occurred with illnesses such as the flu, resulting in our healthcare systems being at complete breaking point. If we think about it, it's not going to take much to make our healthcare systems fall right over the cliff again if COVID cases and hospitalizations start rising. So those are two scenarios then for how things may pan out over the next few months, two extreme different scenarios. And maybe what happens will be in between somewhere. Who knows? Time will tell. But if I was advising any of the authorities in my two favorite countries, the United States and United Kingdom, if I was, say, a government advisor, I would really tell them that they may want to be thinking about what could happen if those hospitalizations start rising again in a few months. That is only sensible, and not be caught off guard. And be prepared to have answers to questions such as, do we go back into a repetitive cycle of lockdowns and things like school closures? Do we keep telling people to isolate who've had close contact with others who developed COVID? And do we want to prepare hospitals and healthcare facilities for those surges if and when they occur? I think we absolutely should prepare for that. It's only sensible. Getting back to the beginning again, we have to strategically think at all times, and one has to have a contingency plan in life. Thanks for listening. Dr. Suneel Dhand. Follow me on YouTube and Facebook, MedStoic Lifestyle Medicine. We will speak again next time.